Hello, thank you for joining me today. We're going to be talking about thermography. Before we begin the presentation, I want to share exactly why I put together this recording for you. This is one of the many examples of some of the patients that come into our clinic for imaging, and it's what drives us every day, and it keeps us going because it's so important. This is a 47-year-old doctor who came in. She had no symptoms, and she was just being proactive with her health and wanted to get a thermography scan. Now, when she came in, we immediately had a concern in the upper outer left breast, and a subsequent ultrasound showed a very suspicious looking mass in that same area. So she followed up with a 3D mammogram that then showed benign microcalcifications on the other side, on the right breast, and she had those biopsied. Thankfully, they came back non-cancerous. But the 3D mammogram didn't show any concern in the left breast, where we had a concern with thermography and with ultrasound. Now, she ended up having a biopsy of a mass, and it came back positive, 1 centimeter in size, and it had not spread to the lymph nodes. So it was great that she was able to deal with this in its early stages. And this is one of the stories that inspired this webinar today. So with that, let me share a little bit about myself. I've been doing thermography for about 15 years, and I've done thousands of scans with so many different types of health scenarios walking through our doors. But our goal is to always help you get answers and clarity on what's going on in your body. So let's talk about how thermography does that. So today, what we're going to cover is basically your common imaging options, different types of scans out there, what thermography is, how it can help you, and a little overview of the procedure. So all the other scans that we're mostly familiar with would be things like X-ray, ultrasound, MRI, mammogram. Now, all of these tools are critical. They're so important, and they give us very important information. However, thermography is unique because it's looking at the activity and the physiology going on in the body. And so it can be a little difficult to explain thermography at first because most people jump to the visuals of structural imaging and trying to understand how thermography compares to that. So the way I like to explain it is if you're looking at a building, you can look at the architectural blueprint of the walls and the structures in the building. Now, what you don't see on structural imaging is the electrical activity flowing through the building, radiation waves and different things like that. So think about all the activity going through a building. You're not going to see that on the architectural blueprints, right? So thermography is kind of like that electrical activity happening, whereas the structural scans that we're used to show the size and shape and density of different structures. So hopefully that gives you an idea of how this compares. Now, a little bit more about thermography is that, again, it's a physiological test. It looks at the infrared heat that's being emitted from your body. So what's great about that is that it is a very non-invasive exam, and it doesn't emit anything from the equipment. So we're used to X-rays emitting radiation, MRIs emitting magnetic fields, and ultrasound emitting sound waves. So we're used to technology that is putting out something that our body's being exposed to. And thermography is unique in that we're not emitting anything from the machine. It's picking up the infrared energy, light, and heat that comes off of your body. Now, this infrared spectrum isn't something that we can visually see, but we can measure it with this technology to a very detailed level. And so what we're doing is we're using that technology to map the very subtle heat patterns on the surface of the body And that can give us clues and indications of different issues going on internally. Now, the FDA approved this as an adjunctive screening tool in 1982 for breast screening specifically, but it's also useful for whole body screening. And we'll talk about that in a little bit. So most people ask me, how deep does thermography look into the body? Again, that's thinking with the other types of imaging that we have where it goes through the body. But with thermography, it's actually utilizing your own nervous system. And so when your nervous system is responding to different conditions and processes internally, the sympathetic nervous system responds in dermal blood flow, and there's a slight increase or decrease in temperature. So there's a normal temperature range for different areas of the body. Just like if you think about your blood work, there's different normal ranges for cholesterol versus blood sugar, right? So when the doctor's looking at different areas of the body, there's a different temperature range that they expect to see you fall within that temperature range. And if it's higher or hotter than normal or cooler than normal, that can indicate different issues. So our camera is going to be, when it takes an image, it takes over hundreds of thousands of individual temperature recordings in each image, and each pixel has a recorded temperature to a tenth of a degree. So these are things that you don't necessarily feel are going on in your body, but it's a way for us to visualize all this information very quickly. And then we have a licensed medical doctor who's board certified in thermology and experienced interpreting this information into a clinical report for you to have, and you can share that with your doctor and be proactive with your health. So some of the things that thermography is not going to show you, again, structural information, things like lumps, cysts, microcalcifications, hernias, internal lesions, thyroid nodules. Now, we might see in that area that there's an abnormal heat pattern or blood flow pattern or something abnormal. And so we might then recommend, okay, now that we see there's something abnormal in this area, let's get some structural imaging and see what's going on. Now, you might have a normal scan, but in this instance, if you had an abnormal thermography scan, we would probably follow up from there if we needed to. So what it can't visualize is important to understand. It doesn't go through the skull. Now, it doesn't go through bone. And so we can't assess bone information and we can't assess brain information. So that would be a limitation of thermography. And we can't see the extent of lymphoma or cancer cells and things like that in the body. Now, we might see inflammation or abnormal blood flow and things like that. But none of these imaging tools are going to diagnose cancer. You only can get that through a biopsy. So all of these imaging tools, we're all trying to find signs of abnormalities, find signs of cancer. And if any of these tools see something abnormal, we have to follow up with a biopsy in order to really determine what it is. So just to explain that limitation, and that goes across the board with all imaging tools. Now, what it can see is signs of arthritis, inflammation, gout, joint issues, autonomic and immune dysfunction, which is kind of interesting. It's like a chronic immune stress. We see signs of different breast conditions, heart dysfunction, carotid arteries, the big arteries in the neck here. We see issues with that. We see colon inflammation and irritation. We see dental pathology and oral inflammation and infection, TMJ. Sometimes we see issues with the bladder, prostate, uterus, or ovaries. Sometimes we see issues with a possible hormone imbalance. Certain patterns can indicate that. That would then motivate you and your doctor to, hey, maybe I do need to prioritize getting a hormone panel done. You might see liver gallbladder dysfunction come up on your scan. You might see some lymphatic congestion, Patterns of blood sugar issues and metabolic issues can come up as a pattern. And a lot of times people have connective myofascial issues and connective tissue that causes pain and tension in the body. So we can see visually issues with that. Nerve damage, nerve root issues, referred pain. So sometimes people feel pain and it's actually coming from a different area of the body. My own father had that issue where he had pain in his thigh that was severe, and he did physical therapy because that's kind of like your frontline plan from the doctors to start with PT. And it was getting worse and worse and worse. And he came in for a thermography scan, and his thigh was completely fine. It was all his low back that was affecting that area. So referred pain can be something that we can help assess. Kidney and adrenal dysfunction, sometimes that might come up on a scan. We see sinus issues and allergy patterns all the time, unfortunately, and thyroid issues. So here's an example. We took one picture here on this left-hand side of this elderly gentleman in his 70s, and you can see he's got significant sinus inflammation. You can see he has a little bit of flare around the nostrils, which is common with allergies. You can see dental oral inflammation, specifically a hot spot in his upper left mouth to get checked out with the dentist. And we see a lot of lymphatic congestion here in his neck, possible a little bit of thyroid stress there too. And in his chest, we see there's an abnormal coolness over the left side of the chest. Now notice you don't see that on the right side. It's only on the left. And this would be a concern for his heart. So with one image, we're able to see a slew of different health stressors going on in his body that he can then be proactive and preventive and start addressing these issues from a more comprehensive approach instead of just separate pieces of the body. We really want to get a whole assessment here. So some example findings we see here. This is an abnormal coolness on this side of this man's face, and that is from the nerve damage from a stroke. So again, we don't just look for hot spots, we look for abnormal cool patterns as well. And here in the center, you can see some thyroid dysfunction over the right lobe. Now, we would recommend following up with a full thyroid panel, maybe consider a thyroid ultrasound. In her case, she had a benign nodule there and a little bit of subclinical hypothyroidism going on. So there's a lot of different cases and different scenarios that can come about. But this, again, is like a non-invasive way for us to get a whole overview of the body safely and see if there's any highlighted areas that need further evaluation. So here we see there's a gentleman with high CRP in his blood work. That's an inflammatory marker. You can see this is starting to affect his circulation, and that's something that he would want to be working on with his provider. You see here, this patient had some severe TMJ inflammation in her jaw. Now, usually it's more subtle than what this looks like here, but that's just an example. And in this patient, she came in and we let her know, hey, you have something going on in your left eye. For some reason, it's a lot more inflamed compared to your right eye. So you might want to get that checked out. And she let us know that it actually was a precancerous spot in her nevus retina. And so again, with thermography, we don't know if something is cancer or precancerous. It's really important if something does come up abnormal on your scan to follow up with further evaluation and make sure we rule out the more concerning things. So here's an example of a patient that came in. He had abnormal episodes of illness that would come out of nowhere, and he'd have these episodes that were unexplained. He worked with multiple doctors and specialists. He saw a functional medicine doctor who really did the works as far as different testing, and she ended up sending him our way to see if there was anything that could come up on his scan. Now, his whole scan, head to toe, was pretty normal, pretty optimal looking, except for all of this oral region. And I was really concerned about his root canals and if they might be causing some of these odd illness issues that he had. And in his case, he ended up having his root canals removed and treated. and they tested off the charts for some really inflammatory bacteria. And when this hidden infection was removed, because he had zero pain, zero symptoms that he was connecting to root canals, all of his illness episodes completely resolved and have not come back for years. So that was really amazing for him and for his doctor to finally get answers. Here's a few more examples. So I mentioned on one of the previous slides, it can show patterns of immune dysfunction, and this is that blue cool spot here we see on some patients with chronic fatigue, chronic inflammatory conditions, chronic allergies, adrenal issues. It can be a number of different things that would contribute to this pattern coming up, but it essentially means that your body's been under chronic stress for a long time and is starting to become more and more imbalanced. So sometimes this can lead to autoimmune conditions, and you really want to work on a whole comprehensive approach when this pattern comes up on the scan. The lower left image is a patient with frozen shoulder. You can see that this patient had her right kidney come up on the scan, which we followed up with an ultrasound. It ended up just being a cyst, so we weren't concerned about that whatsoever. Her blood work was fine, but it was interesting that that came up as a little warm spot on her scan. And then in this image, you can see there's a few different areas of inflammation. Now, certain areas of the body have normal areas, like normal elevations in heat. So that would be underneath the breast and in the groin underwear line region here. That's normal. But in the abdominal region, we want to see less of this yellow here and this orange. The belly button that's normal for it to be hot. But all these areas are indicating a little bit of inflammation in the liver area, in the colon area here, and as well as in the uterus. So multiple areas to work on as far as her inflammatory load. Here's a few other examples. We see some varicose veins here. That comes up very often. We see the pain from the sciatic nerve in the left side. You can see the inflammation in her low back, probably not helping here. And then it goes towards the left with these two little orange spots in that sciatic region in the hip area. And then we can see the left buttock area is a lot cooler compared to the right. That's because all these nerves here are being impacted, and it's shutting down the nerve flow to that left side and causing significant pain. So she felt all the pain here, but it was actually rooted up above that. And I know a lot of different therapists and different providers work on that type of issue, but that's just an example of how it can come up as a cold area. Now, diverticulitis is on the other end of the spectrum, where it comes up really warm and it's inflamed in the colon here. You can see that. Now, let's talk a little bit more about breast imaging. We shared that story in the beginning about the doctor who came in with no symptoms, no concerns, and thank goodness she did, because we were able to find early stage of breast cancer. Now, I love to talk about mammograms and thermography because everybody's going to ask me that. And there are pros to mammograms, and that would be that they're easy access. They're accepted by doctors. They show microcalcifications. They're covered by insurance for the most part. And they do have a high detection rate in fatty or fibrocystic tissue. And I'm going to explain that in a second. Now, the downsides and challenges are that there is radiation, right? So there's ionizing radiation that is not healthy for us, especially over repeated cumulative exposure. And we already have a lot of exposures from the environment, from different things. So we want to be smart about our exposures for medical procedures. Women with dense breasts absorb more radiation than women with fatty and fibrocystic tissue. So they are going to have more harmful exposure. And women who have genetic variations, like the BRCA gene mutations, they have a harder time in repairing from DNA damage. And that's what radiation exposure can do, is DNA damage. So we have this kind of tough spot where we want to use tools to help these women who are at higher risk of breast cancer, but I would love to see more safe tools used in those for those patients. And those are some of the drawbacks here. There's also a lot of pressure applied to the tissue. So there's a little bit of concern there as far as damage and radiation at the same time, and just there being more likely to be DNA mutations. There's just some risks involved. It's not a harmless, I know we always have to weigh the benefits and the risks, right? So I'm just sharing honestly, there are some downsides to it, right? It's not a neutral procedure. There are some little downsides to it. And depending on who you talk to is going to vary on how much they emphasize that. A lot of standard doctors are going to minimize that risk and issue, while more holistic preventive doctors tend to be a little bit more cautious about that. So it's a controversial subject, but specifically with dense breast, the biggest concern I have is that it does lower the detection rate. And so some studies show even as low as 30% detection rate, 52% detection rate, kind of in between there. And so you can have women come in for a mammogram with active breast cancer, but because they have dense breast tissue, it's harder for them to see it and they might miss it. It's also difficult for patients who are younger than 50. And this was a study that I linked here that shows that essentially even women without dense breasts, it was harder for them to be accurate with the mammograms from 40 to 50. So even younger, it's going to be a challenge. And then women with implants, it's difficult to image. Women who are really flat chested, it's hard to pull the tissue in between the plates because that's what's being imaged. So that's difficult. And women with mastectomies, they don't necessarily get mammograms anymore. They don't really get any imaging anymore. So we like to kind of fill the gap in those patients and offer them additional screening, another way to get assessed. Women with really large breasts can be difficult to image as well. And women who are pregnant or breastfeeding, it's not really recommended. And it's difficult to get the chest wall and the armpit, underarm area imaged. And if you do see a lump on the mammogram, it's difficult for them to tell if it's a cyst, like has fluid in it and it's benign, or if it's a solid lump. So they oftentimes, if they see a lump, they typically need to do an ultrasound or further imaging to determine what kind of lump it is. And inflammatory breast cancer is a type of cancer that goes spread through the skin and lymph. So it's very aggressive, but it's hard to pick up because it doesn't form a lump. So here's a quick explanation of breast density and why it's so important. Women who have fatty and fibroglandular tissue, this is what it looks like on their mammogram. It's easier for them to spot cancer because cancer shows up as a white area on the mammogram. And you can see most of this is gray, dark gray, and black in these areas. So pretty easy to assess. Now, when we get heterogeneously dense or extremely dense tissue, that's when it gets more and more and more and more cloudy in here and white. And so it is very difficult to see a white cancer among a whole breast tissue that appears that way, right? So that's why some women are going to be big promoters of mammograms and how great it was for them. But then you might hear other stories of women saying, oh, well, I had a mammogram and it didn't see my breast cancer. They probably had dense breast tissue. So it's 50% of women have dense breast tissue. It's not a small issue. And this is why it's so important for people to start to become more and more aware. And thankfully now we have laws that require imaging centers to inform the patient if they have dense tissue. But unfortunately, patients don't know much more than beyond that. They're just like, oh yeah, I was told I have dense tissue. They're not explained what that actually means and how they really need to advocate for themselves to get additional types of imaging tools built into their screening plan to help protect them better. So thermography, amazing tool with no radiation, no compression, no pain, no contrast. It does pick up signs of inflammatory breast cancer. It is breast health focused, and it's helpful for younger women as well. And it's not impacted by breast density. It also has a predictive value. So even if you don't have breast cancer yet, we might see abnormal health patterns that would indicate you going in that direction down the road. And we never want to speak fear over someone about that. We just want you to be empowered with information sooner so you can take action and start to, be proactive about things. And it does tend to pick up aggressive tumors quicker and easier, which is very, very critical and important, right? It's the first alarm in 60% of breast cancers found. So they did a large study with thermography and mammograms, and thermography was like in 60% of breast cancers, the first one to pick up an issue. May play a role in prevention, again, just because it's focused on your health overall and can help us become more motivated with our health and taking action on things and lowering our inflammation. That's all going in the direction of prevention, right? We can't guarantee things and we can't control life, but we can take steps to be preventive and proactive with our health. Now, the detection rates for breast cancer specifically is in the 80s to 90s percentile. So it is something that is pretty solidly reliable and a very good tool to use considering all of these different factors. It's pretty amazing. Some of the downsides is that it's not covered by traditional insurance. It's covered by supplemental insurance like Aflac, or health share companies might cover it. HSA and FSA will cover it, but your classic Blue Cross Blue Shield or Aetna is not going to cover it. If you're pregnant or breastfeeding, it's safe, but it's not going to be accurate during that time because the breast tissue is so overly active on that during that period that it's really difficult for us to see what's going on there. So we recommend doing an ultrasound if you're pregnant or breastfeeding and have any breast concerns. Now, there's no structural information like we talked about in the beginning. And so we recommend a mix of tools, right? Now, it doesn't replace structural imaging. So we like to utilize things like ultrasound, there's MRI, there's mammograms, there's a mix of tools that we can use. And that's something that's between you and your doctor to decide what's best for you. Over the last 15 plus years of doing this and working in this industry, I am very much an advocate of customized medicine and personalized care. So determining what is the right fit for you might look different than what's the right fit for someone else. So it's important to consider your own risk factors, your own comfort level with different types of procedures, their risks and benefits, and moving forward, with as much information as you can. So that's what this whole talk is about today, trying to inform you so you can make a decision that's best for you. So thermography fills the gap for young women too. I think this is important to talk about because unfortunately we're seeing more cancer in younger people as well. Now, this is a tool we can use sooner than later, and I would recommend in their late 20s to early 30s going ahead and getting a breast baseline scan or a full body scan and seeing if there's anything abnormal that we can be proactive about and preventive. We see women come in their 30s and 40s and they already have breast cancer, and cancer typically starts years before that. And we want to, reverse this cancer problem in our country. So the sooner, the better. We can get a jump on your health. And especially for young women, they have more dense breasts. They have more aggressive cancers. They have a higher false positive, meaning they are told something's wrong when there's nothing wrong with mammograms. And there's a higher false negative, meaning they go in for a mammogram and they're told everything's fine and it's not. So they're at risk from a lot of different ways. And so, again, this is why I think it's such a great tool for this patient population. So here's a few examples of the breast area specifically. This was a patient in her 40s. She came in and we immediately saw concern, unfortunately, on the right breast. Ended up being triple negative breast cancer, which is a little bit more aggressive and difficult to treat. So we were really glad that she came in. On the right-hand side, this is an example of a male patient with breast cancer. You can see that in his right chest here. This is a blood vessel that's coming over to feed the growth of the tumor. So that's what we're really looking for. You can see kind of a similar thing here where she's got this blood vessel coming from the sternum, coming across the breast and looping around. And this was the area of a lump that she had. Now down below, not all breast cancers create this perfect little loop and line across the chest. Sometimes it looks a little different, and this is what lobular breast cancer looked like for this patient. And over here you can see an example of just normal breast tissue. So moving on, here's another example. This was a 37-year-old patient who came in, and her first scan looked not too bad, not too imbalanced from one side to the other. But then when she came back in 3 months, we always recommend new patients come back in 3 months to see if there's any change in the pattern. If there's a change in the pattern, we know that there's probably some kind of process happening that we need to keep an eye on or investigate further. And in her case, you can see that pattern that was really like more diffuse and spread out and subtle here becomes really defined. So you see this like defined marking here and a little tiny loop in there. And that was our first really concern level there. Now she went and had a mammogram that was inconclusive, probably because she was 37, probably dense tissue. It's a little harder for them to see things clearly there. So she was told to come back in a year. And meanwhile, thermography continued to show drastic changes in that area each time she came in for a follow-up. So at this point, she demanded further investigation, even though she wasn't due for her annual scan yet with mammography. And they ended up finding a small calcification that was 1 millimeter in size in this area, and it was tested positive. So she had a lumpectomy. It was teeny, teeny, tiny. So she had a lumpectomy, and she's been doing well for the last few years. So that was great for her. Now, a lot of people are like, well, is there, research on thermography? We have the case examples, the individual examples, but people really need to look at broad research that is on large groups of people to really know if something is a legitimate tool or not. And so I think it's really important to share briefly some research, and there's more research available, but just sharing a little bit here is this study. There's over 800 peer-reviewed studies on thermography, just so you know. There's a lot of research. Now, this study is over 16,000 participants, and you can see that thermography did very well compared to mammography when it came to sensitivity, which means picking up cancer that's present, and specificity, which means basically being accurate as far as saying, hey, this person doesn't have breast cancer. It was doing very well in comparison to mammography. So the author suggested none of the techniques available for screening for breast carcinoma and evaluating patients with breast-related symptoms are sufficiently accurate to be used alone. For best results, a multimodal approach should be used. Now, I see that talked about a lot in different research studies comparing mammography and thermography, is that a lot of times they conclude that, a mix of tools should be used. And, you can clearly see that thermography does a very good job. This was another study of 61,000 participants over a 10-year period. And thermography had 89% sensitivity and specificity. And so it did really, really well. 91% of the non-palpable cancers, that means they were too small to be felt, which is pretty good. 91% of them were detected by thermography. And of all the patients with cancer, thermography was the only alarm in 60% of the cases. So that's another great study. This is a study of 4,000 breast cancer patients, and some of them were really teeny tiny, only 3 to 5 millimeters in size. And they compared mammograms and thermography picking up these tiny cancers. And they showed that thermography picked up 50%. Well, actually, I'm sorry. Thermography picked up 90%. And mammography picked up 50%. So you can see there's quite a difference with thermography and mammograms. And you can see also, don't lose the fact that there's still 10% that thermography didn't see, right? So I say that humbly because I feel like so many people hype up these imaging tools and talk to women as if this is the tool that's going to 100% find something. And reality is there's no tool that is 100% detection, right? So again, I don't want us to throw out the baby with the bathwater when it comes to mammograms, ultrasound, thermography. All of these tools are useful in their own way, but this is just to show that thermography really can show up and do a good job. So here we have a comparative analysis of thermography. This means they looked at numerous studies over the past 30 years, and they were able to see that thermography on average had a sensitivity of 83% versus 66% compared to mammography, and the combination of the two had a 95% sensitivity. So these are really large, long-term studies being done. And this is a link, a picture of a whole slew of studies specifically for breast screening. And I say that because there's a lot of studies on thermography and mammograms, and they're studies on different parts of the clinical picture. These are studies that are done specifically for general population screenings. And you can see that they have different percentages. Now, 0.97 means 97% sensitivity or detection rate, right? So these are the events. This means how many breast cancers were in the study, and then how many were detected. How many were detected and how many were in the study. And so overall, they did all these different reviews of thermography, and these are recent in the 2000s. I have to point out all these details because I feel like it's important for people to recognize this is quality data, and it came out 89% sensitivity. So overall, there's different things to consider with breast screening, and you're going to see there's a variety of detection rates with mammography. This is because of density. So extremely dense tissue, you're going to have the lower end of the spectrum. Fatty tissue, you're going to have the higher end of the spectrum. And that's why I always tell women one size does not fit all, and we want to personalize care. Now, thermography doesn't have sensitivity, an issue with dense breast tissue. So overall, it's 89%, like we talked about. And ultrasound, you can look at a lot of different studies, comparative reviews, and overall, it's about 80%. It just varies depending on the technician's experience and the radiologist's experience as well. But I like this chart because we can see very quickly which ones have radiation or contrast, which ones are useful for women under 40, which ones are safe for implants, which ones see microcalcifications, solid lump or a cyst, determining between those two types of lumps. Ultrasound can do that. Useful during pregnancy or breastfeeding, and useful for prevention and health. Now, that's the only one that comes up with thermography, because all the other tools we're using are structural, where we are waiting until breast cancer is already present, already established, to see anything. And with thermography, I love that we can see physiological, inflammatory, and lymphatic changes potentially before there is a lump there, because all of these unhealthy issues are going to occur before a lump shows up. So that's the opportunity. Now, again, it's not 100%, but that's the opportunity we have here with thermography is becoming more aware of our health, and I love that. So here's some examples. We have people come in for thermography. They have no idea that they have so much inflammation going on in their gut, for example. And she ended up doing some gut testing and working on her diet and taking some supplements and things to help with inflammation. Look at the change, not only in her gut, but you can see the inflammation in her back reduced as well. And you're going to see a little bit of a difference in the image quality because this was an older version of the camera, and we updated from this scan to this one, we updated our camera to the latest and greatest thermography camera. They came out with a newer model that was more detailed, and of course we wanted to update our equipment. This is another patient. These are people who are already health conscious, and they're being proactive with thermography, and it's like, wow, sometimes it's a little bit of a wake-up call knowing that you need to really dial things in better. And so you can see some of these dramatic differences. And again, this person had more back discomfort than anything else, but working on her gut health reduced that back inflammation. She didn't do anything specifically for her back, but her back inflammation came down. So that's pretty cool. These are a few more examples of changes that can happen. Sometimes within 3 to 6 months, we see this kind of change happen for people, which is very encouraging and motivating for people to know that they can do something about their health. And this was a patient who had really extensive colon inflammation. And when she started working on her health, she came in, she saw significant progress. But what was helpful about this was seeing that there's still a lot of inflammation there, that she needed to keep up the work, because you know how many of us, we make healthy changes, we start to feel better, and then we start to slack off, right? So this really helped to motivate her to keep going and keep sticking to the plan and keep making healthy choices for herself, because she did not have room to start backsliding on things because it was right there ready to take back over again. So sometimes we got to stay on top of it. Now, here's a little bit about the screening procedure. Now, you can book your scan online. You fill out the intake forms before your appointment. You come to the imaging office, and you get changed into a hospital gown. Depending on the area of the body, like if you're doing a full body scan, you would want to remove most of the clothing, if not all of the clothing. For a breast scan, you just need to remove the top portion of clothing and any necklace, put up the hair, and then we put the gown on. And during the imaging scan, we turn off the lights, we're chit-chatting, we make it as comfortable as possible. And I can't tell you how many times we have heard hundreds and thousands of patients tell us, wow, I thought this was going to be really uncomfortable and stressful and awkward. And they're like, this was so great. Thank you so much for making me comfortable, making me feel cared for. Like, we really pride ourselves on making sure you have a good experience. Every scan is done by a certified clinical thermographer, and the scanning session might be 15 minutes to 45 minutes, depending on what type of scan you chose to do. So the report process, this takes about a week to 10 days to get the report back from the board certified thermologist that reads the scans. So we get that report back in about a week, week and a half. Now we can do urgent processing, which is a little fee, and you get your results back within 48 hours. We also offer a complimentary report review. So this is a free one-on-one phone call, and we go through the results with you on the phone, answer any questions you have, make sure we discuss any possible next steps that you can consider with your doctor, and go from there, because we really want you to fully understand the report and get the full value out of that scan. All right, thank you so much. That covers everything for today. And if you have any questions, you can reach out to us directly, get back with the provider that shared this information with you. We want to help you get answers with your health, help you be proactive about things. And again, if you have any questions at all, just reach out to us. We're very honest about what thermography would be helpful with. And if you share a certain concern, such as, we've had people call, they're worried about a brain tumor. Well, thermography, like I said in the beginning, doesn't go through the skull. So we're very honest with you about what we can help you with and what you need to seek other imaging tools for. So if you're ever confused about all of this, just contact us and we can talk through what would be the best fit for you. And of course, always talk with your doctor as well about what the best plan for screening would be for you as well. So thank you again so much for your time today. I hope this was helpful, and be blessed.